Hi all, Leah here. Today we're going to be going over the Healthy diagnosis workflow for our providers here at Family Well Health. So this workflow matters because Healthy right now automatically pulls all active diagnoses from a patient's profile into every new chart note, as you may have seen. And if a patient's diagnosis list isn't reviewed and cleaned up, it's very possible that it's outdated or maybe there's multiple types of diagnoses that are redundant and irrelevant that will then appear in the note, which is then leading to our documentation being inaccurate and potentially a compliance risk. So we're going to go over this workflow so that we can help resolve this issue. So what we're going to do first is I'm going to share my screen with you so you can see a test patient's diagnoses. So we are currently in Sleeping Beauty's profile, and best practice for this workflow is to review the diagnoses after your session. So you're going, to have your session note and review the diagnoses there, but it's best practice to clean up the diagnoses after you've met with the patient and hopefully have a more clear clinical picture of what diagnoses would be accurate. So after the session, I'm going to go into actions and then into diagnoses. And you can see here this mega list of diagnoses, right? Postpartum depression, adjustment with depressed mood, anxiety, etc. And, as clinicians, we know a lot of these are redundant. So based off of my pretend session with Sleeping Beauty, I'm going to clean these up. So based off my session, I can tell that, the most accurate kind of depressive diagnosis for covering the depression would be postpartum depression. So I'm going to go into this little pencil here for the adjustment disorder with depressed mood, and I'm going to mark it inactive. And you can choose the end date as today, as the day you're doing it, and I'm going to save. Okay. Same here. I'm seeing postpartum depression. I'm also seeing this major depressive, my goodness, major depressive disorder, single episode. I believe, in my clinical judgment, postpartum depression is the accurate diagnosis. So I'm going to go into the pencil, mark the MDD inactive, and then choose the end date. Okay. Similar with the anxiety, right? I'm seeing anxiety disorder unspecified. I'm seeing adjustment disorder with anxiety, and I'm seeing generalized anxiety disorder, right? There's a lot of overlap there. We're not needing all three of those. So based off my clinical judgment from the session that I had with the patient, for the sake of this test, I'm going to stick with the anxiety disorder unspecified. So I'm going to go into the adjustment disorder with anxiety and mark that inactive and choose the end date. And same with the generalized anxiety disorder, inactive, and choose the date. So now the next session you have with your patient, whether it's next week or in 2 weeks, when you have that new chart note, you'll be able to see that the diagnoses are updated. It's important to know that this is not like you can't backtrack with this. So the diagnoses in the chart for the session that you just had will still be there. And it doesn't change the diagnoses for the session that just occurred, only the ongoing session. So it is best practice to go back after each session just to make sure that that diagnosis list is still accurate. Additionally, I just want to be clear too that changing the diagnoses in your chart note will not change them on the diagnosis list. So it's not like vice versa. You have to change them in the diagnosis list under actions for it to change in the actual session note um, list. My final point here is that this is also a really good time to remind patients of their diagnoses. They should be told at the end of their intake when or excuse me, what their diagnoses are. But if it's changing, especially from an adjustment disorder to, a generalized anxiety disorder or a major depressive disorder, this is a really good time to remind patients or just inform them of what their diagnoses are. So there you have it. There's the healthy diagnosis workflow. Please be in touch if you have any further questions. You can speak to me, your lead provider educator, or your manager. Either of us would be happy to give you more information. Thanks.